demonstrate phacoemulsion cataract surgery in a female dog. She's 6 years old Labrador female, and she is suffering from diabetes and got this cataract. The owner came to know about this cataract late when they actually find their dog keep on banging with the obstacles. So on ultrasound examination, we found that uh, the there is very irregular shaped lens capsule, and this cataract is quite dense. So we are going to remove this, and as this is an old case and the lens capsule has irregular border, so there are chances that I may not able to put a lens, and this is quite precise surgery. So I just uh, will not able to talk much, and if anything goes wrong, I'll stop this live stream as well. So yeah, let's start with our procedure. So the first step is side port. Then I'll create a side port. I've been trained to you know do a side port and a main port incision. So I'll be making a side port first, and then side port patla wala, yellow wala, and then a main port. देना मुझे. So I'll be first making my side port to get it entered. Into the interior chamber. Position is not that good for me to enter. Can I have a Pinocane? Pinocane then? Pinocane? थोड़ा और रिलैक्स करना थोड़ा सा. I'll be now going side and injecting this local anesthetic. So this is containing uh, lignocaine along with some adrenaline and tropicamide, and then I'll inject a dye. So for injecting a dye, I'll have to first place air followed by the dye. So I'm going in. I'll wait for 30 seconds and then we'll विस्को मोटी सुई लगाओ उसमें, वो नीली वाली सुई ही यूज किया करो हमेशा. I will then go inside and inject a lot of visco here. I will then make my main port. नीला वाला, हाँ वही वही वही. थोड़ा ऊपर से वो डालना, पानी साफ करना, डाल दो. इधर डालो, इधर साइड में. Now making my side port. Okay, I'll again have some visco. पानी डालना. You may find the pupil actually coming out. वो सुई देना. तो पानी नया एनएस खोल लो. I'll go inside. I'll add some more visco. सब यहाँ रखा करो, मुझे हाथ में दिया करो. दिया करो. So we're going like this, and then I'll so multifocal forceps, इसको normal NS लो. I'll go inside. Great. Can I have more visco, please? So we have done a capsular axis. Now I'll add some more visco, and I'll add visco inside the capsule so that there is the pupil coming out, because my incision is bit larger and the pressure is higher. ये चालू करो, खोलो इसको. हाँ, वैक्यूम को करना 250 पे. हाँ, पावर को करना 80 पे. हाँ, ठीक है. Okay, so now I'll go inside, I'll press this pupil and we'll try to suck. As this lens is very uh, soft, I'm not using a double port because I can able to manage this with a single port. So I'll put some more visco inside. As my cornea is bleeding, my pupil is bleeding slightly. I am worried about going with the next port and alter the or manipulate the pupil. So I'm doing this with just one port. वैक्यूम को कर देना 400 पे. I'm changing my settings of machine. बस. I'll come out and put some more visco just to protect the endothelium and tunnel structures. I'll add some more visco to get this fragment in the center. Okay, so now we have cleared the cataract. The white strands that you are looking in your screen inside the uh, uh, lens, inside the lens capsule is actually uh, you can say uh, capsule that needs to be polished. So now I'll switch this to aspiration irrigation mode. Can I have another visco, please? वाला निकालना एस्पिरेशन इरिगेशन वाला था ना ये नीला और लाल वाला try to push back this from inside. Excuse me. इसको ढंग से पकड़ो तुम दबा के just want to take out all the bubbles so that I can have a clean look. This. Can I have irrigation aspiration? Set up please. चालू करना इसको कर लेना 500 पे हाँ बस बस और उसको उसको और 30 पे कर देना 20 वाले को 30 पे IA1 दबाओ IA1 US3 के बाद हाँ अब फिर से वो करो वैक्यूम को 400 करो 450 बस okay so this is our irrigation aspiration step to clear the lens capsule so switch hands and we'll first go inside like this and then I'll go inside like this and we'll try to as this is an old standing case visco देना so the capsule is quite fragile. As I told you in the beginning that in ultrasound we found that there is uh, fragile irregular capsule. So if I'm going to do much of irrigation aspiration, then there are chances that I may do a posterior capsule rupture, and then that will be a not disaster, but that will be an additional trauma to already traumatized eye. So I'm just going to see if there is anything I can pick up from the capsule. I'll try to clear this two strands located just at the visual axis. Okay, I think I cannot able to clear that. That's firmly there. So I'm not going to disturb this eye anymore. But we have a clear eye and this dog can able to see nicely. So can I have some RL please? I'll just irrigate the eyes to see if there is any visco inside. Great. And now I'll suture this. So can I have 80? I'll intentionally put some air, and I'm not going to put a lens here because the lens capsule is quite fragile, and while placing a lens there are chances that that posterior capsule will rupture and my lens will go inside the vitreous chamber and that will cause a disaster. So if you don't place a lens in a dog, that is equally fine, he can able to see. The main function of lens is to you know to provide a resolution, but it's fine that dogs they have 80. They have other senses quite working well, and uh, they can do well and they can see well without the lenses. So I'm not going to put a lens. I'm not going to disturb the lens capsule that is almost at the verge of breaking. And I've put a air over here, just that air will keep that capsule uh, keep that capsule pressed inside, and then the eye will get settled. So I will be now suturing my incision. As my incision is large, so I am suturing it. Otherwise, I usually go for hydro sealing, which is quite common in human practice, but it works well with the dog's eyes as well. Positioning the dog eye is something that I always struggle with. I have a patient positioning pillow, but still I need to adjust the eye. इसको खोल लेना, ढीला कर लेना उसको. ये पकड़ के रखना पड़ेगा. हल्का सा पकड़ के रखना भी हो. एक बार और डालना पानी. बस. So I have double locked this, and I'll go through conjunctiva and take this thread out. And that's how it will be a non-irritating to the cornea. And this is 80 Vicryl, so it can get dissolved soon. Now the other strand, uh, for the other strand that I have, okay. And for the side port that I made, I'll do a hydro dissection. So वो सफेद वाली सुई थी ना, सफेद सुई वो किए थे, पतली सुई, हाँ, और RL. So now you guys can see this is my side port, and I'm going to do uh, hydro dissection in this side port. Sorry, hydro sealing in this side port. So hydro sealing is basically when you inject a small amount of fluid between the layer of cornea, and that actually gets swelled up and sealed. Yeah. So now you can see that my needle cannot go inside. See, so it is sealed now. So the surgery is done. However, this trauma that is caused by the artery forceps will get subsided soon. I'll inject triamcinolone and amikacin solution uh, subconjunctively to provide an anti-inflammatory and antibiotic properties around the eye, and rest it will be continued orally. So ideally, this is not a good, patient to do a surgery, but she's suffering from diabetes, and we have to uh, do this surgery to save the eye. and we have done that. Always when you are not confident in putting a lens, and when you know that by putting lens or by doing anything that causes a posterior capsule rupture, avoid that. Hmm. Okay. So yeah, that is it for the surgery, and thanks for watching. And I'll try to live stream some more surgeries whenever I receive them. So yeah, please take care of yourself, and bye.